It is International Hair Loss Awareness Month. Let's discuss surgical options for hair loss treatment. The ISHRS has stated that there has been a 20% increase since 2021 of patients looking for hair transplantation surgery. In fact, the average age of first-time seekers ranges from 26 to 35 years old, and over half of patients who get their first transplantation surgery tend to be between the ages of 30 and 49 years old. This includes both men and women. Now, there are two types of procedures that are very commonly done. There's the FUT procedure, Follicular Unit Transplantation, and the FUE procedure, Follicular Unit Extraction. There are pros and cons to both, and definitely a discussion to have with your physician. But to just discuss quickly, the FUT procedure is when a piece of the scalp is excised from the back of the head, and then a linear scar is left in its place. So if you're going to keep your hair even a little bit long, it's a really great option for you, especially because you can then take that skin, divide it up into the grafts that you need, and those grafts tend to be really healthy and tend to do very well in terms of their survival rate once they are implanted in the recipient site. The FUE procedure is another procedure. It's very common and very popular right now. It's when essentially you go and you punch out individual grafts from the donor site, again, the back of the head, and you then utilize those grafts in the recipient site. This is a little bit more of a meticulous procedure. It takes a little bit longer to do. It's a longer surgery for sure. However, the bonus of that is in the back of the scalp, you get these little tiny dot scars. So it's not completely scarless, but the dots tend to be very, very small. So if you keep your hair short, it's aesthetically more pleasing in that way. Hair transplant surgery has gone a long way through history. You know, it used to be hair plugs that looked awful and unnatural, and now these days, if it's done right, I mean, chef's kiss, you can't even tell you had a surgery done. You just have this wonderful head of hair. So definitely an option to discuss with your hair transplant surgeon. Let me know if you have any questions, and as always, let's stay learning.